started in a second. So I'm changing his remarks to turn it over to Johnson Superintendent.
Would she be after me?
But we'll just have her stand up. You don't have to introduce her. Don't worry.
Okay. And mine ends in thank you, so she'll know. Get it.
Okay, I promise you I won't sing, and I know I can't dance. Well, first of all, welcome everybody. I'm Mayor Policina. For those of you who don't know who I am, and those of you who don't want to know who I am, I'm your mayor, and I'm proud to be your mayor. I am an alumnus of Johnston High School, class of 1972, a long time ago. Next year will be graduated 50 years, and I'm proud to be a Panther. So with that said, we have some very special guests here today, but I want to say to everyone today, I've been a registered nurse about 35, 36 years. It is very important that you get your vaccination if you haven't done so already. Very, very important. And I tell people all the time, especially my EMT students, and most of them, they're all high school students that I teach to, that just stop and close your eyes and think of somebody that you really, really, really love. Okay? Someone you really love. Would you really want them getting sick because either themselves or you as a student or someone else was not vaccinated? So we really encourage that, and that's been really an important mantra, if you will, for our governor and our lieutenant governor who are here today. I'm going to introduce them in a moment. So please, if you haven't been vaccinated, especially our youth, it's very, very important because we want to beat this darn pandemic, and we can. Listen. We're not only America, but we're Johnston, and we're Johnston strong. So I encourage all of you that if you haven't gotten your vaccination, today we're giving out vaccinations. Johnston firefighters are here, along with the police, but the firefighters will be giving injections today. I should go slow. I'm sorry. I don't mean to talk too fast. That's the Italian in me. But seriously, please get your vaccination. It's so important. And I will tell you this, it saves lives. And the life that you save may be either your own or someone that you really love, a family member, especially for our youth who has grandparents at home and parents at home. So that being said, here today, we are very honored to be here today with our special guest, truly honored. I've known the governor for a long time. When he was the mayor of Cumberland, we've become dear friends. I was very happy when he decided to run for lieutenant governor, and I was very happy when he became the governor. But he's here today with a very special lady, I think. We've become good friends, and I had the honor of being on the committee to choose the top finalists for the next lieutenant governor. And I will tell you, at the time she was the president of the Providence City Council, Sabina Matos, she outshined all of the candidates that were there. She did a fabulous job. So she's here. Our Lieutenant Governor Sabina Matos is here. So that being said, please, please, please get your vaccination. If not today, get it soon. That being said, I'd like to introduce, obviously, my dear friend, but most importantly, our great governor, that's Governor Dan McKee. Let's have a warm round of applause for him.
See you tonight. Thanks, Mayor. We'll see you tonight as well. I mean, he's a champion. I remember opening up this field because the mayor called me and said he'd like to run up and down the field with him. Yeah. I brought Charlie Lombardi along. I stayed in the net because I don't play soccer, but Charlie Lombardi was out there running. I think he pulled a hamstring. I think he pulled a hamstring that night. So, Mayor, thank you so much for hosting us here today in Johnston, and to our Johnston superintendent for having us here at the Johnston High School. You'll hear from Mike Looney, the executive director of the Rhode Island Scholastic League as well. But before I start my comments, we got the vaccines going, but Mayor Policina and the first responders, both are on the fire, and a number of the volunteers in Johnston really stepped up in a big way as we started vaccinating the state of Rhode Island. And so this here today is just another round of the way that Johnston leadership has stepped up to make sure that people know that vaccinations is important. And the Mayor, you'll be happy to know that we're slightly over 85% of the adults 18 and over who are vaccinated in the state of Rhode Island with at least one shot. That's spectacular work by the local leaders, along with our Department of Health with Dr. Alexander Scott and others, our National Guard, and the list is long. But we really are grateful for all of them, and we highlighted it and we honored them at the water fire just 2 weeks ago. So I'd like to talk about what's happening here today. The first 50 people will get vaccinated. We'll get a $5 Dunkin' Donuts gift card. And if you're in Johnston, take this opportunity to get vaccinated today. It is time. We're here in Johnston to talk about teamwork. And because we know our student athletes are very competitive, I just said hello to them out there, and we want to challenge them to help us in our efforts to get shots in the arms. And Johnston has one of the communities that still needs to move up a little bit on the vaccination rate. So this is a great chance to actually make that happen. So help your town to move up and in terms of vaccinations, and that'll keep everybody in Johnston even safer as a result of the work that's going on here today. We're doing our part to make vaccines as accessible as possible. There have been 99 school-based clinics across the state so far. More than 3,000 doses have been administered at these clinics, and more will be administered today. Next, I want to update everyone on our larger vaccination efforts, and there's good news here. As of this morning, Rhode Island is one of the top states in the nation of percent of adults fully vaccinated, and we lead the nation in testing, as we had when I became governor, and that continues today under the leadership of Dr. Alexander Scott and the Health Department. I really want Rhode Islanders to hear that. I want them to be proud of that. The latest, again, shows that 86% of Rhode Islanders 18 and older have at least one shot, and 66% of all eligible Rhode Islanders have at least one shot. That makes us one of 4 states in the country that has achieved this goal as quickly as we have. But we want to move up that ladder. We want to keep on keeping us safer. The more vaccinations we get, the safer we are. As I do every COVID update, I want to do the countdown for the number of Rhode Islanders who have yet to be vaccinated. When we started this countdown a few weeks ago, we were at more than 180,000. Actually, this summer when we started talking, we were closer to 240,000. Today, we have seen that number drop to 145,000. That number is going down very quickly, and we will reach 90% vaccinated in the state of Rhode Island. Now, as a basketball coach for many years, I know what being part of a team can mean for your experience in growing up. It can be everything. You're there for each other through the wins and losses, the big moments and the small ones, but as a team, you work together. And one key piece of being a team player is caring for your teammates. I've said good teams have good players. For the very best teams have good players who help each other out. And one key piece of being a team player is caring for your teammates. All of us here, your coaches and friends, want to be able to continue to practice together, play together, and work harder. Celebrate together all season long, and be ready for basketball and hockey seasons that are right around the corner. This year means that we need to get vaccinated to make that happen. You can be an MVP by getting a VAX, by getting vaccinated. You've already gotten vaccinated. Talk to your team and your friend and share experiences. Coaches, we need you to work with your teams and your parents to get vaccinated together as a team. Just like you wear protective gear to protect your family from injury during a game, get vaccinated that will protect you from COVID-19 infection and on the field and off the field. If you're not on a sports team but a fan or head up another club or organization, we need you to get vaccinated. From debate teams to theater assemblies, don't let COVID be the reason you have to pause those activities that you love. I know a lot of you out there are working on your college applications and thinking about next year and next steps. We are so proud of the leadership of our college universities. I believe it's a national story that's yet to be covered. Every single college and university in Rhode Island requires the COVID-19 vaccines for students. This means that on average, there are about 94% vaccinated. I just want to reiterate to the people who are listening to these my comments. Can you imagine, without that leadership, that we'd have 60,000 students in the state of Rhode Island attending our universities and not knowing whether they were vaccinated? And then 40 to 70,000, depending on what our attendance is this year, of out-of-state and out-of-country people, students, and their families have come to Rhode Island in the last few days. Could you imagine us trying to manage that with 100,000 plus students in the state of Rhode Island that we didn't know whether they were vaccinated or not? It is extraordinary leadership, and I really want to make sure that I continue to give our thanks to our colleges. We can do the same thing at our high schools. Absolutely can do the same thing at high schools. So get a jump start. Just like with all the other vaccinations, you need to attend school, get your COVID-19 shot. The Pfizer vaccine is now FDA approved. While Johnston may be taking on Central behind us today, we're all Team Rhode Island. We're one team in the state of Rhode Island. And we need everyone vaccinated to be a winning team. And with that, I'll turn it over to Dr. Alexander Scott from the Department of Health. Doctor?
Good afternoon. Thank you all for being here today. It's great to also be here myself. I want to start with taking a moment to wish a blessed Yom Kippur to those for whom this is a sacred time of the year. Today is also my birthday, and I've been honored to be born on a Yom Kippur. So blessings to all of those who are honoring today. Thank you for everyone's recognition of how important it is to be here. So proud of seeing these beautiful faces and all the energy that's here in Johnston. I also want to recognize and thank Mayor Policina, as well as the governor, thank Dr. DeLullo and the whole Johnston School family for welcoming us here today. Beautiful weather day to be outside. I also want to acknowledge Mike and everyone at the Rhode Island Interscholastic League for their tremendous leadership and partnership throughout the pandemic. Mike has worked with our one and only Sandra Powell from the Rhode Island Department of Health, who is here today, and so many others to help keep our student athletes safe. And from day one, we have really appreciated how wonderfully the Rhode Island Interscholastic League has been in helping to ensure that our kids can stay athletic, enjoy, and do it in a safe way. It's such an important message that we're delivering today. The importance of vaccination, the importance of going to school and being safe and being able to enjoy athletics, outdoors, coming together in a safe way. Every one of us has the chance to be a messenger about the fact that this is possible. When you get vaccinated, you are helping communicate to your friends, your teammates, your classmates, your colleagues, your family members, how critical it is that we get as many people vaccinated against COVID-19 as possible. High school students make up a significant portion of Rhode Island. High school students, you can make a difference with this. With this more contagious version of COVID-19, the Delta variant circulating, we need everyone to do your part. This is an opportunity for our students to take the lead. The last 2 years have been hard for everyone, especially our students. Events were canceled, so were sports games, birthday parties, school plays, and concerts. But our students have done an amazing job adapting, along with our families, teachers, and the entire school community. But we know it can be different this year. We have the tools that work. Getting vaccinated is the way to continue to bring our community back together safely. Parents out there, we know what works. Getting vaccinated, indoor masking, good ventilation, accessing our nation-leading testing program, doing all of the mitigation steps that make a difference. That's what's going to work to keep our students safe. Johnston Senior High, you're doing a great job making vaccines available, as are the schools all across Rhode Island. So if you're listening, if you're 12 and older, the opportunity is there for you to do your part. Take the lead for your family members, for your loved ones. Get vaccinated if you're eligible. Emily and Mohammed and so many other students are setting such a tremendous example. Thank you for that. Thank you all for what you're doing. Together, we are going to make it a great year. And with that, I will pass it off to Dr. DeLullo. Thank you.
Thank you, Dr. Alexander Scott. I want to welcome everybody here this afternoon, particularly the governor for picking Johnston as the spot to make this announcement, because vaccination is such an important part of us continuing with this school year. Dr. Scott's team yesterday helped us tremendously as we had a number of cases at one of our elementary schools. And they were there for us. They spent an hour on the phone with us. They guided us. So, Dr. Scott, thank you to you and your staff for supporting us yesterday when we needed that support in Johnston. Mayor Policina has always been a supporter of our schools. We've had vaccination clinics at Johnston High School and at the Recreation Center. We've had testing clinics in our schools. I want to thank Chief Raza, as he is our leader in terms of our community-based clinics. So, Chief Raza, thank you so much. And once again, to all of our students, as soon as you're eligible for vaccination, it would be great to have you get your vaccinations, get done with the vaccinations. It helps with all of our school activities. It helps with us in terms of us isolating students when they have to be isolated because they're at close contact. If you're vaccinated and in school, you don't have to go through that process if you're not showing symptoms. So again, it's such an important day for us. It's important for students to remember to get their vaccination. Hopefully, we'll be able to get our students 12 and under vaccinated soon, so we'll have a close to normal school year as possible. So once again, thank you all for being here. Welcome to our state leaders and our local leaders. And with that being said, we are going to move it over to Mike Lunny from the Interscholastic League. Mike?
Thank you, Superintendent DeLullo. And good afternoon, everyone. Governor McKee, Lieutenant Governor Matos, happy birthday, Dr. Alexander Scott. Didn't know that, but happy birthday. COVID Response Director Tom McCarthy, Mayor Policina, and representatives from the Johnston School Department and the many other state agencies that are represented here today. And most importantly, a very special welcome to the Johnston High School student athletes that are behind me, that are what this is all about. So we want to welcome them. We all know that last year was one of the most unprecedented years, not only in education, but in high school sports as well. A huge debt of gratitude needs to be given and extended to state officials, the Rhode Department of Health, the Rhode Department of Education, to principals, to superintendents, administrators, teachers, athletic directors, coaches, officials, and staff members that worked so tirelessly to make sure that we had a successful school year in high school sports. Everyone's willingness to sacrifice, pivot, and adjust at a moment's notice just made things tremendous, and it just shows that our league and our state has tremendous leaders all the way throughout that understand the importance that education-based athletics play in the roles of the lives of our student athletes all across Rhode Island. After a year and a half of disruption, limited spectators, and shortened seasons, we are happy to have a full slate of athletic activities this fall. Nothing brings schools and communities together like high school sports, and we have already seen the excitement and the school spirit return with full in-person learning and spectators filling our stands, supporting their schools and their teams. With that said, we know that this school year, both academically and athletically, will continue to be filled with challenges because of COVID-19. In the world of sports, athletes are conditioned to look for any tool available to them to overcome adversity and be successful. With that in mind, vaccinations are the most valuable tool at our disposal to mitigate the spread of the virus and to keep kids in school for learning and on the playing fields and courts. As teammates, your best ability is availability, and being vaccinated gives you the best chance to not miss participation opportunities. In closing, we want to wish all of our member schools the best of luck in their upcoming sports seasons, and we encourage everyone that's eligible to get vaccinated and stay in the game. Don't miss your shot. Thank you. And at this time, it's my pleasure to introduce one of Johnston's finest student athletes, Emily Iannicelli, and some of her classmates and teammates to come up and say a few words. Emily?
Thank you, Mr. Lunny, and thank you to Governor McKee and everyone who took the time to come to our school today. My name is Emily Iannicelli. I'm a senior here at Johnston High School, and I play basketball and softball. As students and athletes, we have already missed out on so much over the past year and a half because of COVID. Proms, pep rallies, talent shows, concerts, homecoming, and so many other school events have been canceled during the pandemic. Those are things we can never get back. Sports are another huge part of our high school experience. We already missed an entire softball season during my sophomore year, and fans couldn't come to our basketball games last year. As a senior, I do not want to miss one more game because of COVID. My teammates and I want to be able to create some great memories before we graduate from high school. If we are to have any chance of things getting back to normal, it is so important that as many people as possible get their COVID vaccinations. I received both of my shots as soon as they were available for my age group back in the spring at the vaccination clinic held at the Johnston Indoor Rec Center. If you have not yet received your vaccination, on behalf of myself and the 36,000 other high school athletes around the state, please get your shot so we can crush COVID, stay in the game, and most importantly, keep everyone safe and healthy. Thank you.
Get back to work.
Thank you guys. Thank you guys so much.
Good to go?
Go by yourself, you want to?
Yeah, it's a little bit different setting, but if you do have questions, on the COVID issues, that's fine, and certainly we'll spend a few minutes if there's non-COVID issues.
Thank you, Governor. We're going to start with Brian.
Actually, Mr. Lunny, how has COVID impacted the sports season so far, just a few weeks in? Have you had to cancel games, reschedule games? Has it been an issue and an ongoing problem, or is it not as bad as it was before?
Yeah, similar to last year, there have been some interruptions with games, but for the most part, We have had a lot of teams that have vaccinated. The difference this year is that kids are vaccinated, so whole teams are not as being quarantined as much.
What is kind of the protocol, depending if you're vaccinated or unvaccinated?
Well, there's a lot of It's really kind of more complicated this year in a lot of ways. But the most important thing is if you're vaccinated and you're not symptomatic, you will not have to quarantine.
And Superintendent, I don't know if you want to answer the same question. What are you seeing in terms of how school has been affected in terms of are you having to quarantine groups of students or classes or what's that like?
We've had low numbers in most of our schools with the exception of one. Generally, the numbers have been running about 4 to 6 in each of our schools. We had a high number at our Winter Hill School. That was a 13. And we're doing close contact. So we're using that 6-foot radius. We're considering whether students have masks on or not masks on, what the setting is. So obviously a lunch period is much more dangerous than in a classroom. But for the most part, we are trying to keep all of our students in school and only quarantining when necessary.
Next question over here.
Probably best for Dr. Alexander Scott on this. There has been some attention paid to the mandate that healthcare workers must be vaccinated. And while we certainly understand that issue from a public health perspective, some healthcare workers have raised the issue of possibly qualifying for a vaccination exemption on the basis of prior infection and recovery. And is there some way to do that? Do you have a position on that? And is it possible to test that based on something like antibodies in the blood?
Thank you. The medical exemptions that are allowable with our vaccination requirement are very specific ones that have been issued by the Centers for Disease Control and Prevention. They're consistent with what we use for all of the vaccines that are critical and important. Having prior infection is not one of the medical exemptions, and it's an important message to be able to say, even if you have been infected in the past, particularly given how quickly and significantly the Delta strain arrived and became predominant, we are recommending anyone who has already been infected previously to still get vaccinated again. That is the primary protection mechanism, particularly against the Delta strain and also against any future iterations of coronavirus that are necessary. So whether or not you've been infected before, getting vaccinated is your strongest protection.
And to follow up on that, Doctor, it's been reported that although all the colleges have required vaccination of students, not all have required, I believe, vaccination of faculty and staff, although that may have changed. And secondly, it's been reported that, at least at the University of Rhode Island, religious exemptions have been unusually popular, apparently because they simply have a box to check on the web form rather than submit any kind of substantive documentation. So has the state thought about trying to reassess whether the criteria for religious exemption need to be tightened or changed? And well, I'll leave the question there.
Yeah, many colleges and universities who really are the model out there in being the first employers to move in the direction of requiring vaccines while continuing their strong testing program, ventilation, and indoor masking, which are those 4 key components we've been telling businesses and employers that's the way to really ensure safety and confidence for your employees and consumers. Many of the colleges and universities have also moved in the direction of requiring vaccination for their staff and faculty. We absolutely applaud the ones who have done that and really applaud the staff and faculty whose numbers are high as well in terms of vaccination coverage. The religious exemption also has very specific federal requirements that allow for the level of tightening that's in place. It definitely needs to be a strongly held religious belief. There are certain religions that actually fulfill that. our goal is to be here to support employers in being able to implement the strongest vaccination policies possible to help make sure as many Rhode Islanders are safe as we can.
Thank you.
Dr. Scott, you could just stay there for 2 questions, please. On Sunday, the Rhode Island Department of Health tweeted, among other things, that Rhode Island COVID-19 hospitalizations continue to increase as they ask Rhode Islanders to get vaccination. According to HHS.gov Data Hub, Rhode Island hospital capacity taken up by COVID patients was 4.9%, down from 6.22% the previous week. ICU capacity continues to slip, taken up by COVID, dropping from 18+% to under 12% in the same time. Dr. Scott, there exists a significant trust gap with the state of Rhode Island and its citizens for a number of reasons. Generationally, was this an intentional mistake, or was this was an accidental misrepresentation?
I don't see any mistakes. I feel like our Rhode Islanders understand the importance of vaccination, and there are high vaccination rates across the board. You're welcome to ask your second question and further clarify what your first one was.
Well, you've got 2 different numbers. I'm not sure how clear I have to be. There's one number that one website is reporting from the federal government, the other number that Rhode Island's reporting. They're different, and there's a misrepresentation there, maybe unintentional. So I'll just leave that hang. But just as importantly, last week the Coalition Radio attempted to reach the Department of Health and asked them about a practice this week, which meant where this is incredibly enough at the ACI. Bring your family to work day, and one of the traditions in that was to bring people through the prison, which, of course, if you're paying attention to the science, the CDC clearly suggests strongly that no one be interrupting prison communities with those type of tours. We weren't answered again, and we're wondering what the status on that was.
So to respond to the first point, we have a Class Act A+ amazing data team here in Rhode Island that's been throughout the pandemic. We also know that our data, as well as what our federal partners produce, evolves, and we work closely to reconcile when there are any gaps that could be connected to them receiving the information on the update. We can continue to do that. We have throughout the response. Your second question is an important one. You know, we want to ensure that all practices throughout the state are responsive to what's needed to keep people safe and protected from coronavirus. We also, as a department and a state that honors equity and human rights, want to always ensure that everyone is treated like the human beings that they are, regardless of where they reside or why they are there. So that's something we'll continue to support and promote, and we'll look forward to helping to see all practices follow in that vein.
Respectfully, Dr. Scott, you didn't answer the question. Could you please answer the question? Is it happening this week or not? And after the inquiries both from the American Civil Liberties Union as well as small reporting groups like ours, you can't claim that you're not aware of it. So please answer the question. Is it happening or not? We understand you respect the process. Is it happening?
So your question is directed to the Department of Corrections that actually hosts that event. It will be important for them to answer that. And I am aware of it and will continue to work with them on handling that as safely and appropriately as possible. Thank you.
The next question, Pat. Wayne?
You have no oversight over the Department of Corrections.
So, good afternoon. There seems to be some confusion as to whether children under the age of 12 can leave the state and return, and do they have to quarantine for 7 days on their return? So the question is, do children who leave the state and then return under the age of 12 have to quarantine for 7 days when they get back to Rhode Island?
Right, so they certainly can leave. We would support following the guidance that's in place for any unvaccinated community in terms of travel. any unvaccinated population. It's also another reason to go ahead and get vaccinated. Our current travel guidelines do involve a form of quarantining and testing upon return from areas that are hotspots based on our current definition. So we would encourage, one, anyone around a child who is currently ineligible to get vaccinated to be vaccinated to ensure their protection, and two, to follow what our current guidelines are for travel and return from an area that is a hotspot if you are unvaccinated.
Thank you.
Thank you. Lynn?
Hi. Stand up. This is for Governor McKee. On Saturday, it's my understanding that the executive order that requires masking in schools is going to expire. Do you plan to renew that?
Yes.
All right. And Alex?
Question is either for Governor McKee or Dr. Alexander Scott. So you guys have mentioned that Rhode Island continues to be a leader in testing, but with back to school and lots of kids needing to get tested, especially those who are unvaccinated, we've heard from parents in several different districts that the testing backlog has been pretty terrible, and that they've been waiting for days, and it's keeping their kids out of school for days, especially if they're not vaccinated. So I guess my question is, how does the state plan to address the larger volume in testing? And is there any plan under consideration for re-implementing distance learning for those kids that are missing out on school?
So testing is a critical piece for us. We learned some important lessons last year, and we really have a strong, comprehensive testing program that is available. One of the things that happened is the rapid rise of cases. We've had the capacity the entire time to expand as we need to, and that's occurring. Our current testing turnaround is 24 to 48 hours. Our goal has been throughout this pandemic response to get it around that 24-hour mark to the best of our ability. We're confident that we'll continue to respond appropriately to what we are seeing at this very early start in the school year, and make it so that our testing program, along with the updated guidance that's in place that decreases the extent of the quarantine process for those who are vaccinated, are the types of steps that are in place to help minimize disruption in schools. We understand the value of in-person learning and are doing everything we can operationally to ensure that our systems support that.
You have kids, though, that are missing school for potentially a week, and it's just the start of the school, so they're missing out on these things. And some students have said, well, we don't have Google Classroom set up, or we don't have this in place, so these kids are just outright missing school, and some of them may be going to the school for the very first time. So I guess has there been any talk of re-implementing distance learning plans, at least for those situations, maybe not a hybrid situation for the entire classroom, but at least to some extent for these kids that are calling out sick?
Our primary goal operationally from the department's perspective is to ensure that the few numbers of students that have had those extended times continue to get smaller and smaller in terms of that impact. We have the ability to make it so that it's 24 to 48 hours. It's not expected to be long-term, that there's a week, that's not been in place for months. So as school gets started, we're a week or two in, we expect that to smooth out and to make it so that there's as much disruption as possible operationally. In terms of ways to continue to support students and families, that's something that Department of Education is all over, as well as the governor.
All right, I think we have a couple more questions.
So this question may be best directed to Director McCarthy, but maybe Dr. Alexander Scott would want to take it. Have you been in communication with the federal government in terms of what the approval process may look like and time frame for vaccinating people under 12? And, I've read numerous reports that, optimistically maybe end of October or something like that. And I realize that you simply may not have better information than I do, but do you?
No, so that's something obviously we've been watching closely, and we're excited for when those under 12 will be eligible. So what we've been guaranteed is before the end of the year. We have also seen the same reports that potentially as soon as October. I know President Biden committed to ensuring any resources necessary to complete the review would be available. So we're hopeful sooner rather than later. And if they were approved tomorrow, we would be prepared to run those school clinics and begin administering vaccine.
Do you have plans specifically for
We do. I mean, something that's been tremendously successful, and we've seen it just in the last couple of months here, our partnerships with our schools and our cities and towns, those school-based vaccination clinics where people feel comfortable, the vaccines administered by people they know, that has been the gold standard here in Rhode Island, so something we'll look to duplicate as well.
This is either for the governor or for Dr. Scott. You know, given the reason why we're here today about trying to get the message out about vaccinations for student athletes, do you plan on collecting the data in terms of high school student athletes who are vaccinated, and do you need to see a certain threshold in order to make a decision about kids wrestling, basketball, hockey that don't have to compete with masks this winter?
We are absolutely looking at the data continually. It's an excellent question. We want to continue to work with our interscholastic league partners as well as with the federal guidance as it continues to get updated to make determinations about mask wearing and otherwise. We know right now, as contagious as the Delta variant is, that prolonged contact over a period of time does benefit from not only vaccinated protection, but also mask wearing and any other of the mitigation steps that we've discussed. But it's something we assess continually, and as soon as we have ability to advance that further, we will. But we appreciate the students and athletes who have been doing it and making it work and have been the model on how to stay athletic, stay energetic, and also stay protected. Thank you.